Oh, I have many stories, but the one that I will never forget because it left scars in my memory. I took care of this university neurosurgeon, and he had a chronic cough. He has bronchiectasis. Nobody prescribed him a SmartVest. He also had asthma on top of that. So he came with his wife. They've been married 56 years. And I took a history, examined the patient, and then I recommended a minor change in the inhaled therapy. I went to triple therapy and a fixed dose combination inhaler. And I recommended a biologic to address his type 2 inflammation to control his asthma. And he also had chronic rhinosinusitis with nasal polyps. And then I recommended a SmartVest. And then the wife of the neurosurgeon shook her head. You know, her eyes rolled back so far. I saw the whites of her eyes. I thought she was gonna have a freaking seizure. And then I saw her eyes again. She fixed on my eyes and she said, "A vest? Is that all you're gonna do for my husband?" And she just attacked me. I wanted to leave the room right away, you know, because she was getting ready to strike me. I don't know what she was expecting. Maybe she was expecting bronchoscopy from me. A vest? Yes, a vest. And I stuck to my guns. You know, the patient was also referred to Pona rehab. And several weeks later, I called the patient a week later after he got the SmartVest. And the wife said he's doing a little bit better. But then, you know, the patient went to our Pona rehabilitation program that I started in 1994. I happened to be in clinic, and the neurosurgeon came up to me, tapped my shoulder, and said, "Hi, Sam, how are you doing?" "Oh, I'm doing so much better." I said, "Well, what is that making you feel better?" "Oh, the SmartVest." "Oh, really? Your wife said that you're a little bit better." "No, it's so much better. So I'm able to cough. I have more endurance. I can tolerate exercise. I can do Pona rehab." "So Pona rehab is helping?" "Oh, yeah, it's helping." "Well, what about the drug?" "Oh, not as much as the SmartVest." So he taught me, this patient, my colleague, the surgeon, this neurosurgeon taught me that the SmartVest was more beneficial to him, more therapeutic than the biologic, the monoclonal antibody, and more therapeutic than Pona rehab. So again, that's another story that adds to the mountain of cases, of case experience I have that shows that the SmartVest, high frequency chest wall oscillation, needs to be first line whenever you have a patient with chronic cough, with or without bronchiectasis. It's not second line, it's not third line, it should never be an afterthought. This case of the university neurosurgeon has left scars in my mind, but I've learned lessons, very important clinical lessons. Patients may come in with expectations. A lot of them have talked to their family members, their neighbors, other physicians, other surgeons. And so they come and they think they know exactly what their loved one needs. And so when you talk about a vest, they may be under the misconception that this is a vest like what I'm wearing, but they don't understand the advanced technology that is available with the SmartVest and with high frequency chest wall oscillation. And it's important as a physician to listen to the patient and the family member, and then to construct a plan of care and to be consistent with your own past experience and what worked for other patients in the past. It's all about doing a clinical trial of one. And you have to persuade the patient, and in this case, the wife of the patient, the wife of the neurosurgeon, to do a clinical trial of one.